Zambia has one of the world's most devastating HIV and AIDS epidemic in the world. More than 1 in every 7 adults in the country is living with HIV or AIDS. Since many adults in the country are living with HIV, the life expectancy of birth by both sexes has fallen to just 49 years. In 2009, nearly 76,000 adults were newly infected with HIV, about 200 new infections each day. Malnutrition has also been on the rise, attributed to the worsening poverty levels, increased food insecurity, as well as suboptimal infant feeding practices. According to available statistics, 70% of the population is food insecure and 45% of children are stunted, 15% of children are underweight, and 5% wasted. These rates are among the highest in the region. There is also a general critical deficiency of micronutrients, including iodine, iron, and vitamin A among both children and expecting mothers. Other important leading causes also include malaria, diarrheal diseases, and pregnancy disorders.
3 key health issues that we'll be focusing on are malnutrition, HIV/AIDS, maternal health/family planning. Malnutrition is the leading cause of death among children. According to the available data, malnutrition is currently on the rise. Malnutrition greatly affects children across the country. 47% of children are stunted, while 28% are underweight. Vitamin A deficiency is also currently on the rise and continues to be a public health concern. On average, 5% of children have severe vitamin A deficiency, while 49.1% have moderate vitamin A deficiency. In 2011, over 34 million Zambians are living with HIV. HIV/AIDS is the leading cause of death among Zambian adults. Mother-to-child transmission of HIV is the largest source of infection for children under 5 years of age. Because 95% of new infections are driven by preventable factors, we strongly believe that by focusing our attention, raising awareness about HIV/AIDS to the communities, can greatly improve the health of the population. The fertility and maternal mortality rates in Zambia are higher than their regional value. Therefore, maternal health is an enormous health concern in Zambia. Good family planning skills are needed among Zambian couples in order to lower the rate of maternal death, unsafe abortion, and lower fertility rate. We strongly believe that good family planning skills is an important factor in order to improve the health of the population.
We have 3 main interventions to improve the quality of care and equity of access in the Zambian healthcare system: addressing the human resource shortage to develop rural health infrastructure and broaden the basket of primary services provided. In human resources, we aim to increase the staffing component of community health workers in each region and develop a large volunteer base from every rural village and urban neighborhood. We'll strengthen the skill base of both community health workers and volunteers by providing access to free online training, such as the Global Health e-Learning Center. For rural health infrastructure, we'll increase the number of rural health posts from current levels of 20 to 500 to address the high levels of mortality in rural areas. To improve baskets of primary service delivery, we'll create a framework for addressing our main health issues. For addressing high HIV rates, we recommend education through community health workers and volunteers through the UGAN and ABC model, advocating for abstinence, being faithful, and using condoms. We would also like to implement an anti-discrimination campaign to encourage testing for HIV status and provide antiretrovirals to decrease levels of mother-to-child transmission and increase motivation for disease testing. For maternal health and family planning, we recommend family planning education, pregnancy, birthing, and lactation support from community health workers, safe and accessible abortions, and bed nets to control malarial diseases to keep mothers and babies healthy. The importance of targeted family planning and maternal health is enormous. It allows families to break out of the systemic cycle of poverty and ill health by allowing the mother the choice to space her pregnancies and pursue education or employment opportunities as she wishes. Lastly, to address the plague of malnutrition in Zambia, we'll implement a program to provide a micronutrient supplement, including vitamin A drops, and implement a village-by-village awareness campaign with health volunteers to promote safe hygiene and sanitation to reduce diarrheal diseases that have a direct impact on nutrient absorption. Lastly, we'll support and advocate for breastfeeding of infants for the first 6 months of life.
The first and most vulnerable group in Zambia is people living with HIV. For this group of people, our main goals are to provide holistic prevention, care, and support services. Our main focus of this population is to prevent mother-to-child transmission, provide pediatric treatment, prevent infection among adolescents and young people, protect and support children affected by HIV. The second one is southern and western region of Zambia affected by the drought, and this is one of the reasons caused food insecurity, to boost the nutritional status and livelihoods of the most vulnerable and prevent border-borne disease by supporting nutritional livestock and emergency water and sanitation interventions. The third vulnerable group are orphans and vulnerable children. Children are the most likely victims of poverty and household food insecurity, particularly if they are orphaned or living in a household with chronically ill adults. With the funding we receive, the money will be allocated to provide assistance and support to HIV-affected OVC in Zambia. In order to eliminate the causes of the vulnerability, while strengthening families, communities, and the country as a whole.